DocTalk is brought to you by MERCK Animal Health, the science of healthier animals.
Hey folks, welcome to DocTalk. We're going to talk about respiratory disease and respiratory pathology in beef cattle. And we're going to talk about different things from what's the function of the respiratory system to when it gets diseased to when that calf gets sick and how we treat them and how they respond. Stay tuned.
I had this horse. It was a good horse, except for when the wind was blowing above 30 miles an hour. Wind was blowing about 35, 40, and I saddled him up, rode him out to the end of the lane, and I thought, well, he's doing pretty good. And about 6 jumps later, I was laying on the ground and thinking, boy, my shoulders sure hurt. I kept waiting, and it didn't get better, and so I went to an orthopedic surgeon, and that showed that I had torn rotator cuff. He said, well, we'll have to do surgery. I thought, I farm and ranch by myself. This is not going to work out very well. I'd been sleeping in my recliner for about 2.5 years because it hurt too much to sleep in bed on my side. I'd heard about Kansas Regenerative Medicine Center on the radio. Gotten down there at 8 o'clock in the morning, and by 11:30 the procedure was all over. They just took some fat out of my side here and spun that down for about 45 minutes and then injected it in my shoulders, and I was on my way. It's something you don't hear about, but I thought it was worth a try, and I'm really pleased. It's really worked out well for me.
Kansas Farm Bureau has served farm families and rural Kansas for more than 100 years, and we're pleased to offer new healthcare coverage choices for Kansans in 2020 through Kansas Farm Bureau health plans. No matter what stage of life you're in, we'll have options that fit your lifestyle. Plus, our network of providers is one of the largest available throughout the state of Kansas and beyond. For more information, including the different plans available, or to get a quote, visit kfbhealthplans.com.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thomson. We're here at Kansas State University where I serve as the Jones Professor of Clinical Epidemiology. And today we're going to talk about something that I deal with a lot in feedlots, which is respiratory disease. And specifically, we're going to talk about some of the pathology, some of the diagnosis, different things to that nature. So we start out with what is the function of the respiratory system. And the function of the respiratory system, there are many of them. It is to provide oxygen to the body, to eliminate carbon dioxide. It is also there to regulate. You don't understand that how important our breathing is to the pH of the blood, and how we can adjust our blood's pH by breathing off CO2 or breathing in oxygen can kind of impact how you feel and how you function physiologically. The other part of the respiratory system is to make a noise. So all of these things, and of course in that respiratory system there's a way that we defend our body, that we have an immune function to stop disease. So we'll start out with, I think it's important to understand that there's an upper respiratory tract and lower respiratory tract. And the upper respiratory tract is from the nostrils to when we start to have the bifurcation of the bronchioles, so that trachea. So the nasal passages, the sinuses, the larynx, and the trachea are what make up the upper respiratory tract. The lower respiratory tract are basically the lungs. And so people are like, well, why do I care? Well, part of that is if you're standing there with a steer that's in the pen and it's making a noise while it's breathing, if I hear a noise while it's breathing in, that means that the pathology or the disease is in the upper respiratory tract. If I hear that noise when the animal is breathing out, that means it's in the lower. So if I'm standing there and I hear this, And while it's breathing in, I start to think about diphtheria. I start to think about IBR. I start to think about something, maybe a foreign body in the nose. But if I hear that expiratory grunt of that old steer out there, and trust me, I can imitate almost every sound a cow makes. But when I hear that expiratory grunt, I know this is something in the lungs. And watching how that animal breathes can show you the amount of pain and the severity that animal's in. So I think it's important to understand upper respiratory tract, lower respiratory tract, and the sounds that you hear. So I mentioned upper respiratory tract. One of the things that we are seeing more and more in calves is diphtheria. And the part of the problem with diphtheria is because we are feeding in some of the yards where we feed high moisture corn with silage with wet distillers. We have a lot of moisture in those rations with a very low pH. And so the constant amount of low pH liquid in these high moisture diets going over the larynx will cause an irritation. And once we have an irritation, that opens up a little area where bacteria can grab a hold of and create some sort of pathology. Most of the time it takes a virus or it takes some sort of irritant to scratch that mucosal surface, and once that's scratched, then the bacteria can latch on. Fusobacterium necrophorum is what causes diphtheria in calves. It's the same bug that causes liver abscesses and causes foot rot, but it's all set up by the consumption of these high moisture grains. We're going to take a break. When we come back, we'll talk a little bit more about respiratory disease. Hey folks, welcome to our Cattle First Minute. I'm Dr. Dan here, and thanks to Beringer Ingelheim Vet Medica for sponsoring this. When we think about vaccination and vaccinating calves in the fall, or vaccinating your cows in the fall, or summer, or spring, it doesn't matter what time of year, we've got to treat vaccines responsibly, because if you don't, that modified live vaccine becomes a modified dead vaccine. We want to make sure we keep it out of the sunlight. We want to make sure that we keep it cool. We want to make sure that you don't mix up more vaccine that you're going to utilize than what you would utilize in an hour. And when you do, make sure you put it in that cooler that keeps it dark and keeps it cool. All of these things, understanding that the syringes have to be clean so that these products work well. Putting a vaccine that is not efficacious into an animal means you vaccinate the animal, but you don't immunize the animal. And understanding that there's a difference between immunization and vaccination is important for Cattle First.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
SureCrop Fertilizers was started by my father, Don Sherman, and my mother, Shirley Sherman. Family business that started in the 80s. We predominantly focus on plant nutrients and what we can do to give growers better responses with the fertilizer dollars that they do, and what we can do to make those things work better for the grower. We're based out of Seneca, Kansas. We work with growers in their soil analysis to figure out what they need, and then we can put those in a blend that gives them the best results, and so that we can deliver that direct to their farm so that they have those nutrients where they need them, when they need them, and so that they can apply them in a manner that's very efficient to them and works well in their planting systems and what they're doing. SureCrop Fertilizers has been around for a long time. We always say we're big enough to take care of everything you need, but we're small enough to do it quickly. You can get a hold of us at 1-800-635-4743. Our website is surecropfertilizers.com, and you can always email me at Corey@surecropfertilizers.com, and with any questions you have, we're glad to answer it and work with you.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
ValleyVet.com, ValleyVet.com, Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson, and we're talking about respiratory disease pathology. And we got to the larynx, which is the moor of the cow, right? The vocal cords, and they can get diphtheria there. We'll move downstream from there and we'll focus on the trachea. And the trachea is that ringed structure that goes from the larynx to the lungs. And you can feel it on your own body. You can feel the cartilaginous rings that make up that trachea that stays open so that we can move air down to the lungs. What's important to understand is that when we have disease that occurs in the lungs, like respiratory disease, bovine respiratory disease, a lot of times the pathogens that are in the lungs that are causing the disease are carried in the nasal passages as normal bacteria by almost every bovine, okay? It is when there's two reasons why an animal gets sick. Either an overwhelming dose of a pathogen that they haven't ever been exposed to, or a naive or a suppressed immune system. It's the only two reasons. And so what happens in the trachea, we can get a virus called IBR. And IBR can cause pathology within the trachea. But most of the time, pathology within the trachea is limited or microscopic, and we can't see what's causing the issue. But when animals get exposed to a virus, bovine viral diarrhea or BVD or IBR, there are these little hairs, cilia, that grow on the inside. They're microscopic hairs that grow on the inside of that trachea. And they are what carry mucus from the lungs so that you can cough it up or remove it or whatever you want to call it. So what happens is we can have a virus infect the animal, or an animal that gets dehydrated will have tacky mucous membranes. And so the cilia don't work correctly. And when IBR comes into the body and it knocks out those cilia, then we can't have mucociliary clearance. And if you can't have mucociliary clearance, we can't remove the bacteria through the mucus plug to carry it from the lungs up to the larynx, to the pharynx, and to the nasal passages where you blow your nose or cough and cough it up. And so it's very, very important to have mucociliary clearance. I always think of mucociliary clearance whenever I see people at a ball game with a beach ball and they hit it and everybody hits the beach ball and it goes up to the top and it goes over the stadium steps or whatever. Or if they pick somebody up at the bottom and they carry them, every time they carry them and pass that person up, I'm thinking of mucociliary clearance and how we get that mucus plug from the lungs. The other thing that viruses do is that they are very immunosuppressive. They will keep body temperature down and not allow you to have an immune response, and it will also interfere with white blood cells, the production of white blood cells, and the arrival of white blood cells at the site of infection. So the viruses will knock out the mucociliary clearance in the trachea, and then they go and they arrest the ability of the white blood cells to come to where that bacteria are setting up for what we call a secondary infection, which we'll discuss after these messages.
Kansas Corn reminds you that E15 fuel is the right choice for every kind of driver. For the car enthusiast, E15 has higher octane. For the thrifty driver, E15 is priced lower than regular unleaded. For the nature lover, E15 provides cleaner air. For the shopper who buys local, E15 has more ethanol from our Kansas corn farms. Choose E15 for a higher octane, lower price, cleaner American fuel. Message from the Kansas Corn Commission. Learn more at kscorn.com.
When you're in the cattle business, no matter how much it's a business, it still starts with cattle. It's this basic notion that sits at the core of how we approach things at Boehringer Ingelheim. We understand when you put the cattle first, it just naturally leads to doing the right things. If you want to do well in this business, you start by doing right. Take care of the cattle, and they'll take care of you.
Kansans have a new choice for Medicare supplement insurance plans. With Medicare supplement insurance plans from Kansas Farm Bureau, you have access to 4 levels of coverage, affordable rates, and service from an organization that served Kansans for more than 100 years. For more information on Kansas Farm Bureau Medicare supplement plans, including rates and to apply, visit kfbhealthplans.com.
Earlier in my life, I rode bucking horses and rodeos, and my shoulders took such a beating, and that was probably the reason for having several previous surgeries on both shoulders. About a year ago, I decided that I didn't want to have another surgery, and so I contacted Kansas Regenerative Medicine, took their treatment process. It was relatively pain-free. Now, after 8 months, my shoulders have healed to the point where I think I'm probably 90 to 95% of normal. It takes a couple of months to start to see results and feel real progress. That continued to increase gradually until now at approximately 8 months. And I'm extremely pleased. I've got full range of motion. I can lift weights, I can throw, I can do a lot of things that I couldn't do without a lot of pain previously. So I'm tickled to death with the results, and I'd recommend this process to anyone.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Welcome back to DocTalk. I'm Dr. Dan Thomson here at Kansas State University, and I'm talking about respiratory disease and respiratory disease pathology. So, if the mucociliary clearance is knocked out, so then the mucus from your nose or from the calf's nose, where those bacteria, such as, so let me back up. IBR and BVD are the viruses. They come in, they knock out mucociliary clearance, and they suppress the immune system. They're the primary invaders causing disease. That decreases immune response, allows the secondary invaders, which are the bacteria such as Mannheimia hemolytica, and for those of us that are old, it's Hemolytica, Pasteurella hemolytica, or Pasteurella multocida, or Histophilus somnus, otherwise known as Haemophilus somnus, okay? So those bacteria come out of the nose and they will slide in mucus down the trachea to where they go to the bronchioles. Now, any cloven-hoofed animal, like pigs, cattle, they have 3 bronchus, okay? People, birds, anything that's not cloven hoof, a dog, a cat, they only have 2 bronchus, one going to the left lung, one going to the right lung. But in cattle, they have 2 on the right side. So that first bronchus is the one in which, just because of gravity and the way the good Lord in Detroit designed these critters, is the first bronchus that as something slides down the trachea, it's going to go into that right cranial bronchus, or the one up front. So most of the time when we see respiratory disease, the area that's affected by bacteria first is that right-sided, most cranial, meaning towards the head, bronchus, because that's where the infection will come down that trachea and slide into first because of gravity and because of the anatomy. It will eventually go past that bronchus and go into others, but when we see respiratory disease in cattle, it is presented towards the ground, ventral, and cranial, towards the head. So cranial ventral, the front and bottom portions of the lungs, is where we see respiratory disease the most in cattle because of gravity and because of those bronchus. So the secondary invader slides down and it goes into the lung area. And this is where that starts to set up or form a colony. When the bacteria form a colony, it sends out signals and it starts to make the tissue angry within the lungs. And it says, hey, we need white blood cells. So the white blood cells come rushing to the area of infection, if possible. So they come into and they bring fluid. And so we start to get this walling off is part of the defense mechanism of respiratory disease. So first, within the first few hours and days, the cattle start to build a bacterial colony within the lung. That creates the angriness of that tissue or an irritant. and that starts to, the walling off effect, and then it starts to bring in the white blood cells. One of the defense mechanisms of these bacteria is what we call leukotoxin or endotoxin. And what happens is when the white blood cell kills the bacteria, it gives off this leukotoxin, which means white. Leukocytes, leukotoxin. Leukocytes are white blood cells. So this leukotoxin is given off, and it basically kills the white blood cells or destroys the white blood cells in that area. And we'll talk about why that's a bad deal when we come right back.
What if sustainability were synonymous with U.S. soy? If energy efficiency, water quality, and soil health help define U.S. soy's value, that future is here, the time is now. To meet end-user demands, the Soybean Checkoff is committing to sustainability that's achievable, worthwhile, and enduring. A message from the Kansas Soybean Commission, the Soybean Checkoff, progress powered by Kansas farmers.
The elements can be relentless. Make sure they have respiratory protection to match.
Kim Mannering with Hardy Insurance. Today we will talk about employee safety and work comp coverage. On your farm, do you ask your friends to come help? Are they considered employees? Or neighbors helping neighbors? Did you know that you can be held responsible just as if it's a work comp accident? Give me a call, we can discuss. 316-945-6733.
When it comes to stopping horn flies, cattlemen love their Vet Gun. Today they love it even more because Vet Gun now has a 1-2 punch with 2 VetCap insecticides. New AIM-A abamectin can be used in rotation with AIM-L for effective in-season control. Each delivers a unique mode of action to manage hornfly resistance. So start your in-season rotation program with AIM-L and new AIM-A abamectin VetCaps from AgriLabs.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to DocTalk. As we left, the white blood cells had surrounded the bacteria, right? And when they attack that bacteria and kill it, the bacteria gives off the leukotoxins, which means something that's going to kill white blood cells. And once they destroy those white blood cells, the debris and the trash of the destroyed white blood cells is what then starts to form these pus pockets or these chronic abscesses within the lung. So we wall it off, we wall off the infection within the lung. We then have the white blood cells that come in, try to kill the bacteria. And so in between this, what is the calf going through? What am I seeing when that calf is going through this sickness or this illness? So a calf that is sick with respiratory disease has what the acronym DART, okay? Depression, anorexia, and labored respiratory. And a depressed calf is one head down, sunken eyes, a dry nose. Right before you get sick, don't you start to get the chapped lips? Well, chapped lips on a steer is a chapped nose. And when we see that dry nose and sunken eyes from dehydration and the droopy ears from depression, head down, animal being isolated by itself, the next thing I look at is its flank. And that's the anorexia. It's gone off feed. because all of a sudden we've increased this immune system, the animal's starting to run a fever, it's not feeling good, and it's saying, hey, I don't feel like eating, so they go off feed. If they're lame, if they feel pain, or if they're sick, sick cattle don't eat, and cattle that don't eat get sick. All the while, we start to increase respiratory rate because what was going on in the lungs? We start to have a walling off. We're having an increase in fluid, so we decrease the respiratory capacity of that animal, meaning they have to breathe a little bit faster. And then lastly, when they come into the chute and we get them in there, we're going to see an elevated rectal temp. 1015 to 1035 is what we'll see. So I think that is normal rectal temp for calf. So the big thing is early treatment, early detection of respiratory disease helps decrease the amount of damage that we will see in the lungs. It takes 21 days for an animal to form abscesses and for that lung pattern to become what we call chronically ill with abscesses and pus within the lungs. If we can treat those animals in the days that right after that viral infection or right when we start to have that initial bacterial infection, that's when we have the best chance of success. We expect to have 75 to 80% of the cattle that we treat one time with antibiotics to respond and never have to have another treatment. After that, there's 50% success rate on a second treatment, and if you treat an animal 3 times with an antibiotic, which means you've been treating this animal for 7 to 20 days, there's only a 50% likelihood that that animal will go on and become a productive member of your community or your herd. Lot to go on with respiratory disease. I hope you enjoyed the show. I love talking about BRD. I've dealt with it all my professional career in feedlots and stocker operations and that. And so let us know what we can do to help you. Remember, always work with your local veterinarian. And if you want to find out what we do here on DocTalk, you can find us on the web at www.doctalktv.com. I'm Dr. Dan Thomson. Thanks for joining us today, and I'll see you down the road.
Closed captioning brought to you by VetGun with Amel and new AMA Abamectin Vet Caps, the 1-2 punch against hornfly resistance from AgriLabs.
For more information about this program or previous programs, go to DocTalkTV.com.
DocTalk was brought to you by MERCK Animal Health, the science of healthier animals.
Kansas Farm Bureau has served farm families and rural Kansas for more than 100 years, and we're pleased to offer new healthcare coverage choices for Kansans in 2020 through Kansas Farm Bureau health plans. No matter what stage of life you're in, we'll have options that fit your lifestyle. Plus, our network of providers is one of the largest available throughout the state of Kansas and beyond. For more information, including the different plans available, or to get a quote, visit kfbhealthplans.com.
Kim Mannering with Hardy Insurance. Today we will talk about employee safety and work comp coverage. On your farm, do you ask your friends to come help? Are they considered employees or neighbors helping neighbors? Did you know that you can be held responsible just as if it's a work comp accident? Give me a call, we can discuss. 316-945-6733.